Hello everyone, today we're going to talk about facelift. The look and shape of your face vary as you age due to typical age-related changes. Your skin loses elasticity and becomes looser, and fat deposits diminish in certain places of your face while increasing in others. You don't have to give up your young appearance look as you become older. A facelift or rhytidectomy is a cosmetic surgery operation that makes your face seem younger. A facelift surgery can make a patient seem not merely younger, but simply better by removing superfluous, sagging skin, smoothing deep wrinkles, and raising and tightening the deep facial tissues. Our role today is to answer most of your questions regarding facelift. Today we have Dr. Yoon, who is a leading doctor at Field Plastic Surgery. He is going to discuss with us everything about facelifts from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Hello, Dr. Yoon, how are you? Can you please introduce yourself to our audience?
Hi, I'm Dr. Chang-Won Yoon of View Plastic Surgery Clinic. My specialty is in mandibulofacial surgery and facelifting. It is a pleasure to meet you.
Thank you, Dr. Yoon. So my first question would be, how many kinds of facelift techniques in Korea?
Facelifting surgery or procedures can be classified based on the patient's age, physique. It is largely divided into non-incisional and simple procedure using injections.
So what are the difference between all of them?
To elaborate on the pros and cons of each surgical technique, the size of the scar is one factor, and other factors include the direction of the lifting, procedure time, and duration of the result, and so on. We adjust to the individual state of each patient to decide which surgery or procedure to use.
How long does the Smas facelift last?
The surgery we call Smas, facelifting, is one of the longest and hardest surgical methods in facelifting. When it is properly performed, the Smas layer will last about 10 years, depending on your age, and revisional surgery can be performed every 10 years.
So how about thread lift? How long does it last?
Thread lifting, if it is a dissolving thread, loses its effect between 6 to 18 months after the procedure. Of course, the effects don't go away immediately with the thread dissolving. The dissolved thread is replaced with other human tissue. So we generally see 11.5 to 12 years as the maintenance duration, and revisional surgery every 2 years is recommended. A non-dissolving thread has various types, and although it can last longer than 2 years, the effect of the thread itself fades in 2 years and starts acting as a foreign body, which is why it is important that you find a doctor who understands the characteristics of the thread.
What kind of client should have a facelift?
We can't specify a patient who requires a facelift. The patient sees him or herself, and if they think they look old, they consult their doctors and choose the most adequate method. It's not like a certain medical condition dictates the need for facelifting.
Are there any side effects after doing a facelift?
The biggest side effect of facelifting would be patient dissatisfaction. Patients tend to imagine the end result of a facelift to be extremely young and beautiful, but essentially, it is recovering one's own past appearance. They recovered their appearance from 5 to 10 years ago and hold it for 5 to 10 years. Facelifting does not create an entirely new appearance. Its goal is to revert back one's appearance to their best time in their life and hold it there as long as we can. Other possible side effects include neural abnormalities, post-operative hematomas, or infection. These require immediate intervention, so please consult a doctor if you notice them.
What are the risks of having facelift?
There are risks to a facelift if the patient's physical condition is unstable. For example, if they have comorbidities or are of age. If the patient is limited by these factors, facelifting is recommended against them. Facelifting is the reversion of the appearance to the past, healthier self, and not a destructive removal of skin tissue. So it is important to perform the surgery according to the individual's health status. Those who are not in an adequate state shouldn't do it. If there's been a significant weight gain recently or rapid changes to the body, it is better to wait for it to stabilize, as this can affect the end result greatly.
How long will the recovery period be?
The recovery period of facelifting is generally around 2 weeks until stitch removal. Thread lifting, which is considered more or less a procedure than a surgery, allows daily activities 3 to 4 days after the procedure. But the time it takes for the thread inside to stabilize is about 3 weeks. It's important that you do not engage in extensive physical activity when you still feel post-operative pain. Regardless of surgery or procedure type, we recommend a 2-week recovery period for surgical facelifting and about a week of rest for non-surgical thread lifting.
What kind of person is not suitable for a facelift?
Facelifting is not recommended for patients who cannot tolerate anesthesia because they're either too young or too old. It is also recommended against those who experience extensive weight gain, or patients with active infection or ongoing skin troubles. We advise them to recover first before receiving the procedure.
So for my last question, is there any different approach doing surgery of Asian and Caucasian skin type?
The surgical approach to Asian and Caucasian face differs because their facial structures are different. Asians generally have a wider and lower face, which requires relatively more fat to be pulled up or removed. Also, focusing too much on the lifting and removal may disrupt the balance, and this may result in an even wider face, so we have to take caution. While Caucasians have a narrower face with thinner skin, if we lift these faces far too upwards, it can appear even thinner, and although it may look supple, make the face look worse. It is advisable to optimize the lifting direction depending on the difference in macro and anatomical structure, the width and length of the face, the angle of the bone for a better result. Post-operative recovery periods can also be longer for Asians, which need to be factored in.
Today we learned many things about facelift and the doctor discussed everything in depth. While this is a natural path of aging, people who are disturbed by this sign of age may find a facelift to be a useful option. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.